Thank you all for coming. I'm Peter. He's Keith. We are the leadership of Genomic Healthcare Strategies. Keith is going to start off in a second, but from our experience here, I'd like to make a couple of opening remarks. This is a great conference. We've seen many interesting presentations and lots of great people. One of the things that I've noticed is that everyone has talked about point of care almost entirely in traditional medical terms. But my question is, why should we think that that with all the market mechanisms in our capitalist society, that point of care will be constrained by the traditional healthcare system? It's new technology, it's new opportunities. Within healthcare, a lot of work has been done to get point of care started, to get it somewhat regulated, to get it out there. But to us, it's like the internet in the early days, run by government and universities, was only used for FTPing documents back and forth and some email, and look at it now. I'm old enough that I remember the very first scandalous spam message over the web. Those days really are history. We think the future of point of care is a function of markets, not of traditional healthcare, not of regulation, and not confined only to scientists. There's going to be a lot happening using the technology that all of you and others are creating. So with that, I'll turn it over to Keith.
So let me talk a little bit about this evening and the logistics. We have a lot of slides to cover, but we're going to try to move through them rapidly because we really hope that there's a significant amount of time for discussion and questions. And I don't know if any of you have heard me today. I tend to ask sometimes provocative and hopefully intelligent questions, and I'd love for the same from you guys to challenge us. These are the topics that we're going to talk about tonight. If you have any questions in the interim, please feel free to interrupt. So let's talk a little bit about Genomic Healthcare Strategies. It is a consulting organization, and the people in our network are senior experts with backgrounds in pharma, biotech, academia, and business, and we've all had profit and loss responsibility and operational experience. And I think what's interesting is our sole focus has been on molecular medicine and personalized health and wellness. There's another part of this. Consultants to get gigs talk about their domain expertise. You know, we understand pharma, we understand regulatory, we understand this. I think there's another part that Peter and I believe. We've been involved in a bunch of revolutions where the markets have changed. And we'll give some examples of where we've had experience in that, but also I think this is happening in this space now. And we'll give some specific ideas about what that means and some, I think, validating data points that prove our point. My background, I spent some time at the FDA as an Oak Ridge Fellow. I spent 8 years at Mass General Hospital. Amicus I was employee number 4 of a venture-funded healthcare startup that had a positive liquidity event. And I think you might see how I got into this game. I ran multiple clinical trials with biomarkers as surrogate endpoints that got therapeutics through the regulatory process. Peter, the chief operating officer, did undergraduate and graduate work at MIT, that other place down the other side of Cambridge. Boston. And he was the third employee and COO of Apt Associates, $300 million research and consulting firm. So you started at employee number 3 and it grew to 800, roughly? And he's been board member and principal advisors to multiple software startups that have been sold to public companies. In his volunteer work, I think he's very proud of, and I think he should be, he's the co-director of venture mentoring at MIT, which helps startups from the MIT community go out, improve their pitch, raise money, and go on and be productive. How many dollars have been raised in there?
Excuse me. The venture mentoring service at MIT is about 10 years old, has had something like 700 ventures pass through over time.